ladies and gentlemen. And I'd like to welcome you all to another episode of America in Black and White. Tonight, we have a very healthy and intriguing show for you tonight. We've got Dr. Tyris Ford with us tonight. Let me tell you some things about Dr. Ford. Dr. Tyris Ford has a doctorate of nursing practice and is a board-certified family nurse practitioner who owns and provides T&J Direct Primary Care. His practice prioritizes uplifting overall health and wellness through a soul wellness approach to healthcare, focusing on healing the mind, body, and soul. He believes in providing holistic care to all his patients by addressing one's mental, spiritual, and physical health during his patient encounters. Dr. Ford began his nursing journey 11 years ago as a medical assistant, then obtained his Bachelor of Nursing degree and worked in various healthcare settings for 5 years. After that, he received his Doctorate of Nursing practice degree, specializing in family healthcare settings for 5 years. Family medicine, that is. Dr. Ford later served as Director of Clinical Services for a nonprofit focused on mental health, primary care, and gender and reproductive health. As a result, he gained a wealth of knowledge of experience managing the mental health challenges of patients from various backgrounds. Over time, his experience have helped him cultivate love and compassion for the patients he served. When so many worldly factors can interfere with one's health, Dr. Ford believes supporting a patient's physical, mental, and spiritual health is on the utmost importance to help them live an overall healthy life filled with infinite joy. In his spare time, Dr. Ford loves being explorative and seeking new adventures, especially hiking, where he can be agile and free, do yoga, and meditate to help rejuvenate his mind, body, and soul. One of Dr. Ford's favorite quotes happens to be, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." That quote was by Dr. Maya Angelou. Ladies and gentlemen, I give you Dr. Tyris Ford. Welcome to the show, Dr. Ford.
Hey, good evening, good evening. I was like, I just popped in. Good evening, good evening. I'm super excited about the conversation tonight. Thank you so much for the introduction. Hey, everyone who's
Well,
watching.
well, I'm definitely glad that you are here tonight. And with you being here, I mean, it's one of those things that health is very important. And I want to make sure that our audience can learn not only what it is that you do from a medical profession, but some of the techniques and the things that are good for them to think about using in their everyday life.
Absolutely. I'm definitely looking forward to it. And I'll say, hey, everyone. I'm Dr. Ford, Dr. Ty Ford, nurse practitioner here in the DMV area. Charles had a lovely introduction for me, but I like to call myself the soul wellness healer. Soul wellness is focusing on the mind, body, and spirit. Me and my training, I went to Marion University in Indianapolis, and they focused on versus. Oh, did I go out? We good?
No, that was I'm not. There's something going on probably with the network, so I'm sorry about that.
It's all good. I thought I did something. I was like, hold up. Um, so I went to a university, Marion University, back in Indianapolis, and it really had a curriculum heavily focused in healing the person, mind, body, and spirit, healing the whole person. So, that's always been an approach of mine. And I always like to address, the spirit too, because people want to have enthusiasm about their life. You want to have something to live for. You want to feel inspired to, accomplish your dreams and your goals. And, if you don't feel, worthy enough to accomplish those things, or you feel like your health is very poor, and you have a poor outlook on your health, your life will reflect that. So it's very important to help bring people back into alignment in their mind, body, and their spirit. And so I really heavily focus on that. I call it soul wellness. And here in the DC area, because I've been living here in DC for about 3 years now, um, I actually practice family medicine. So primary care, full primary care, we see all types of different patients with all types of different conditions, hypertension, diabetes, people living with HIV, the hypothyroidism, various ailments. So super excited about the conversation tonight, just to kind of talk more about soul wellness and how it can really transform someone's life.
So tell us, when it comes to the soul wellness, um, tell us, when this is going on. Tell exactly what does that approach look like? How do you actually take this on with your clients?
Oh, that's perfect. That's a question because I'm not your traditional provider. Okay, you come to see me, we're gonna get to work. And granted, I don't want to just sit up here and act like I know everything because I definitely don't. I always tell patients and I always tell nursing students it's actually far harder to try to remember and know everything. But I do know how to get the information that's important and how to get credible information. So anyway, I keep it real with people. And so usually when people come into the office, they'll have a seat, and then we get to learn a little bit more about each other. And usually the first thing that comes out of people's mouth is, "I know I should have came to the doctor. It's been about 10 years. I know it's been about 5 years. Well, I know I should have came sooner. I had this problem, but I just didn't want to come to the doctor." And I'm like, relax. Like, why are we feeling shameful about coming to the doctor? You're here now. Let's get to work. And so, people have been, burned by the medical community, and their experiences have been traumatic. And so when they come often to my office, it's like people are almost, they have a lack of faith in the medical community. That is heavy distrust in the Black community, of course. And so, they come broken in a sense. Like they feel like they don't have any more options. It's quite sad to see. So when I have a patient like that, I'm like, oh, we got some work to do. We have to uplift your spirit. Like, so a lot of my questions are around who the person is, like how their life is going, how's their finances, because that may play a role into, like, their overall health. Do they have the means? Also just getting a gauge of like what they enjoy, because that's how I can get them resonate with their spirit. Because if they're talented, I've had artists that come in, and I'm like, show me some of your artistry, like that's the visit. But I think people appreciate a different approach. Of course, we're going to handle your medical concerns. If you had a rash, we're going to make sure we get to the bottom line. But to me, I just don't see a rash. I see a whole person who's has a life, and an experience. So I like to incorporate some things like positive talk, positive affirmation. Deep breathing is definitely one, because so many people will come in nervous. If you've ever been to the doctor's office, people's blood pressure can get elevated just by virtue of them being in the doctor's office, and sometimes they're nervous. So I'll say, before we even get started, I'm like, take a deep breath, because I'm picking up on the energy, I'm picking up on the vibes, you picking up on the vibes. We both getting nervous. Hold up, let's take a deep breath. Okay, cool. And then sometimes they're like, wow, I needed that. I needed to just relax. Wow, yeah, I didn't expect it to be like this. And I'm like, well, good. This is how healthcare is supposed to be. You're supposed to be cared for, mind, body, and spirit. There's so many other ways that I incorporate soul wellness into my practice. But, I think it'd be important just to like outline what I mean by soul wellness. So, um, soul wellness is a mind, body, spirit approach, and how I go about my practice. In other words, you may hear holistic practices, if you've ever heard of that. So holistic is just looking at the whole person. That's all, and making sure that you take into account of their emotional health, their physical health, their spiritual health, their physical health, of course. So what I like to focus on is like a healthy nature. Like how can we get you back to your healthy nature? Making you feel your authentic self, making you feel your most healthiest without all these aches and pains. And I focus on a few things. So we definitely have conversations about nutrition and what you're consuming. Because if you ever heard the old adage, "You are what you eat," that stuff is real. Okay, so you have to be mindful of that. And then we also like talk about detoxing because sometimes when you'll go to the doctor's office, they'll say, "Oh, just go eat fruits and vegetables and go exercise more." But there's really no guidance to help people like know what's healthy to eat. Like they go back to their communities and they don't know what to eat. They go to the grocery store, they don't know what to get. So we talk about nutrition and how that can actually help heal your body, you know, purify your cells, heal your body. We talk about activity. That's what I like to focus on. What are you doing to keep active? And I'm not saying go to the gym because we know you hate going to the gym. you know, I'm saying what do you like? What do you enjoy doing? Do you enjoy dance? Do you enjoy walking? Do you enjoy what are the things that you enjoy that helps you be active? And activity to me doesn't just mean physically. Like, are you also doing things to help stimulate you mentally? Are you reading books? Are you, doing puzzles? Whatever you're doing, like, tell me. And then I help them retrain their mind, if you will. So it's really helping them stay on positive thoughts and positive mindset. So like I will provide, affirmation, especially when I hear them self talking or like self defeating, and or really speaking negatively on their life because I believe this, Charles, you really have to have a positive outlook on your health in order for you to really transform your health. So that is what I would say my soul wellness encompass. And there's more to it, of course, but those are a few things I like to really focus on and help people really renew their mind and really tap into their spirit.
Well, I'll tell you, just when it comes down to it, I know that health is very, very important. And it's one of those things, especially now as we come into 2024 as the front part of this 21st century,
Yes.
um, is that when it comes to health, there's so many things now that people have to do or things they have to learn to do. And people have to, a lot of us are adjusting, some are like just moving forward. And when it comes to health, we think about with all these different illnesses that are plaguing society.
Mhm.
How does what help us to understand about the illnesses that are plaguing people today? What do you think plays a major part in that?
Oh, this is real juicy. I appreciate the question because, for me, I think the biggest thing is like, how do you view your health? Like, how do you view your health? Because if you have a perception of poor health, then you're going to most likely, have those behaviors that actually like facilitate a you know, poor health outlook on poor health outcomes, I should say. That's where I'm getting at. So, I really do depend. It really does depend on like their mind frame and how they view themselves. I'll give you a better example. If a person is overweight and they're trying to lose weight, if they can't really see themselves as that person who is healthy at the weight that they want to be, and they don't see it for themselves, it's going to be very, very difficult for them to incorporate make the changes, be consistent. Things may throw them off. It takes a lot of dedication when you're really trying to improve your health. And if you don't have strong support on that, then have a strong view of what that looks like. I think that's really the biggest barrier. The other thing is your environment can have a major influence on your health. So I know in the Black community it's Black History Month, so happy Black History Month to everyone. So we oftentimes do look at a lot of health disparities, and we know that Black people are disproportionately affected by many different conditions. One of the main things is heart disease and diabetes, and also when we think about male specific, female specific, there's different nuances, but main thing that I see and what we are concerned about is like heart disease and diabetes. And so I often hear when patients come into the clinic, they're like, "Well, my family, everyone in my family has diabetes, so eventually I'll end up having diabetes. It just runs in my family." You know, when people have that mindset, they're more likely to end up developing diabetes, and it's not because you're just thinking it. It's because that thought is gonna, you're gonna start engaging in behaviors that actually, you know, feed into that belief. So I really do think it's a mindset thing. We don't talk about it enough, and usually in the medical community, we'll say it's chop it up to genetics. But it's like if everybody in your family was eating pork chops, and then you was eating pork chops, just because you grew up and you started to learn that this was a good, nutritious food for you, soulful food, and everybody in your family has done it, and everybody now has high blood pressure or diabetes. Here you are having the same thing. It's really that mindset to try to shift it so you can actually start being more healthy and tapping into your healthy nature. So that's what I find is the biggest piece. What would you say? I want to hear your perspective.
Well, I mean, I can say that, true enough, being in the Black community, I have heard, several people say that. And so I kind of like wonder, like, where does that come from, or why do they think that way? You know, I always say, pretty much as you started out, you are what you eat, but also if you are not willing to change some things in your life, then what will be will be.
Mhm.
But if there are things that you are trying to avoid, and if being healthy is one of those things where you have to do some exercising and some other things, and you're
Yes,
not doing them, then that's on you. But yeah, I just wonder about that, because I think the mindset is really, really um important, but also just in that, and because this me playing devil's advocate, but I think it's true. A lot of people have been misdiagnosed with this as well.
absolutely. Absolutely. And thank you for your perspective because I definitely, to me, I believe wholeheartedly it is mental a lot of the time. And, often we're just like seeing the physical here in the clinic and we're like, oh, it's a rash. Let me treat that. I know exactly what to do with that. And it's like, what is the root cause of why you keep getting this damn rash? Like, let me figure this out. And so, that's how I like to go about it. But I will say for sure that, it is a mindset thing in my opinion. But you raise a really good point in terms of, um, people, people, if you don't have the support, you don't have the structure in place, and you don't have the self confidence or the self worth. These are things that I like to talk about. That you can actually be healthy and you can visualize yourself being healthy. It's going to be very hard for you actually to achieve those things. And then if you do achieve it, it it's going to be so easy for you to fall back on some of your you know original habits that kept you away from being your healthy self. So that mindset thing is really really important. So what I do when patients come in and they're like, oh, I've effed off my life. That's usually how they present it. I done messed up my life, and now I'm here and I want to take full ownership of my health. I said, cool. I want you to know that you don't have to beat yourself up anymore. You're here right now because The point of power is right now. Like today, you made a decision. Like you make a decision every day to get up, brush your teeth, do things that you enjoy, do things that you like, and you also make a decision to say Cheetos versus like, Cheetos versus carrots. And then you got the choice to be like pizza, me eating out pizza or like me making my own. Like I just people are default to convenience and don't make these things a priority. And that's why I say it's a mindset thing. It's like retraining your mind to prioritize your health and start making healthier options, but also give yourself. Oh, am I breaking up a little bit? Sorry here.
Uh-huh.
Oh, okay. Hold up. You ain't tell me.
Well, because I thought, because it like it clears up, but then it's like it goes back.
Oh, okay. I'm gonna try to be a little bit more clear. I think I can see my mic now. Okay. So but yeah, I really do think that plays a major role into people's health. Um, and I like to tell them and remind them, hey, the point of power is right now. Like you chose to come in here today to change your health. You're here now. Give yourself a pat on the back. And so people usually feel very empowered when you come at them like that, and offer it like that because they know that you're like invested in their health and they get motivated about, taking ownership of their own health. It's very different, you compared to some of my other colleagues and how they practice medicine.
Well, so tell me this. Can you share some insights into your journey as a doctor of nursing?
Yeah, absolutely. I posted a video earlier today that just talked about like how nursing really really helped save my life and learning about the mind and how it works and the diseases that affect the mind, knowing the conditions that affect the body, and also how people can be almost spiritually empty, like like feeling like they don't have anything to live for, and
Right.
understanding those concepts really helped me be more mindful of like how I treat people and how I care for people. So I've always thought I was going to be a lawyer. But decided to go into nursing. How many people influenced me, um, and many people nursed me as a child, and particularly care for me, especially after I had a gun wound injury when I was younger. And um, one of my mom's good friends, she would nurse me all the time. I had a lot of different. As I reflect on my life, I had a lot of different people who were caregivers to me, and that's important. And that held on to me. I always knew that I was a giver, and I always knew that I had the ability to, heal people, in various ways. So, going into nursing just really sit with my soul. Like I was always that friend that would do something for someone. But I think the important thing that I've learned across my journey is that I need to take more time for myself. But um, to be real, I started off as you said, mentioned earlier, medical assistant, CNA, and I worked my way up. Just being consistent and knowing what the vision was, because I knew that I was going to make a major impact. Whether it is in nurse, it was going to be in nursing somehow, some way. And I really chose to go into a nursing route because I've had people ask me, why didn't you choose to be a doctor, like a medical doctor? I'll say there's the angle in which we're trained is just different. So chose to do the nursing thing, and it's really been fruitful, honestly. Been able to change and heal a lot of people's lives working in the ICU, especially around COVID. Um, and then now being a nurse practitioner, I'm actually able to have my own practice and actually have people enrolled in that practice and care for them in the way that I want to. because working for other companies and organizations, some providers are restricted on what they can and can't do. And that's so unfortunate because there are a lot of providers out here that are eager to heal people holistically, but they just don't have the time. So I took it upon myself to just start my own business, start my own practice, and here I am. It's been going very, very well. So I'll say my journey has been very dynamic. I've definitely could talk way more about it, but
Well, I tell you, it seems like that you had some motivation and some inspirations when it came to doing whatever it is that you decided you want to do.
Mhm.
But tell our audience what inspired you to build a clinic focused on cultivating genuine and productive relationships with patients in primary care.
Absolutely. Like, that again, one of the reasons why I just like started, I feel like my life has just been like, it just shot up. But I started my own practice because I felt restricted as a provider. Like when people would come into the office and they'll say, "Hey, I got X, Y, and Z, and I have all these things going on with me, and I only have 10 minutes with you," that's a problem. And I'm like, is nobody else seeing this? Is you come in and you have all these things that you want to mention to your provider, but you only see me for 5 seconds, and I literally don't have any time to talk about anything else. Like to me, the care is so compromised, and you know, I really saw no other way of like really providing the type of care that I wanted to provide, which is focusing on the whole person and taking that angle. Unless I started my own thing, and started my own practice. So I focus it on healing the whole person because again, that's my like basis of my training. But who wants to live a life that is not full of happiness and joy, or like you deal with chronic pain and you just bounce from doctor to doctor just because you just need pain medicines. Like if people are looking for healing, and I think it's even more important now because we're getting exposed to different types of chemicals, different foods, you know, um, different toxins, and we have to care for ourselves. But how many providers can help walk you through that process? So I call my business trust in the journey because you do have to trust in the journey and you trust in the process, and you should build a partnership with your provider. That's what I believe. Like we should have a partnership in this because you're an active participant in your health, and it's just so I'm active in this thing. So I believe a partnership with your healthcare provider really leads to healthy outcomes, optimum health outcomes. So that's really what propelled me. So building that partnership is important to me. So I make sure I incorporate that into my practice and make sure that my patients have that access to me as their provider, and they can trust me.
So, can you tell me this? Tell us this: how many of your patients, are black compared to white or Hispanic?
Yeah, absolutely. So it's a kind of a mix. I actually worked in quite a couple settings here in the DC area, and it's very interesting because you have an area like Petworth that's kind of near. I don't even know how to even explain it, but in DC you have a area that are heavily populated. Got people that may be using substances. You know, near university, so a lot of younger children, younger age individuals, anywhere from 24 all the way up to about 60. Um, so there's different communities, pockets of communities. So based on where you work in DC, you actually could have a stark difference of like being heavily seeing a lot of ethnic cultures um, versus seeing purely Caucasian individuals. So I've had a little bit of both. My practice is a mixture. I would say more so on people of color and of different races, ethnicities, I should say. So I'll say for my practice, about 80% black. Try to, just being real, it's about 80% black, but like the people are looking for that, But I will say that I do have some Caucasian individuals in my practice, and I do have other ethnicities as well, which is cool. And I do see quite a, if I had to quantify, I see more younger individuals in my practice. So that age range from 24 all the way up to about 40. I see that younger group, which is a blessing.
Mm. So tell us this. How do you envision making primary care more personal, convenient, and effective in your clinic?
Yeah. So with my practice, I have a direct primary care practice, and a lot of people don't know what direct primary care is, which is allowing you to have you allowing you to have convenient access to your provider, and so you can build that relationship with your provider. So I believe in my patients; they should be able to get into the office either same day or next day, or they should be able to contact me to ask a question, because sometimes you may just have that question of like, okay, I got a cold, I, I got this chest, this cough sitting here in my chest. Is it chest pain? I don't know. Am I having a heart attack? Do I need to go to the ER, or can I just call Dr. Ty? And then for patients to have that ability to just call me, and say, hey, what should I do? Having that consult, that easy access, that reassurance, is important. So I incorporate that as a part of my practice, where people can have that access. The other thing is, I don't have any rush to visits. No more 10-minute visits. No more. I take my time. I take my time. And that's what I like. So, my patients value that. They value that I take my time. I research with them. I educate them. You So these are some things that I love to incorporate into my practice, and a lot of mindfulness activities. So you may do some mirror work with me. You may do some breathing work with me. We may actually go walk around, around the clinic, you know, just as a stress relief. But I have that time. I've had plenty of patients even come in and, just chill, and we just have a conversation because they wanted to talk. They wanted to let some things out. So um, I really, really feel like adding all of those elements into my practice helps me transform what family medicine is supposed to look like, or primary care looks like.
Well, I think those things are actually better than usual. But I want you to do me a favor and kind of check to see if like there's something that's plaguing your mic or whatever have you.
Okay.
Because just while you were speaking, I mean, I could hear you, but you had a lot of the static stuff moving through.
Okay. Give me 1 second.
Mhm.
Give me 1 second. Let me make sure I got my audio.
Okay, turn up the volume. I can hear you now. Just turn up your volume.
Give me 1 second.
No. Um, whichever that was that you was doing before, it was coming up where I could hear you, but it was like just low. You got to turn it up though.
Can you hear me now?
Yes,
Okay.
yes. There we go.
All right.
No problem. Could you share your perspective on the role, um, um, like for you, with you being a doctor and so forth? Can you explain, like what this would do, or like how this would impact you, as to with your clients and patients to see you on America in Black and White? What do you think the impact of that's going to be?
And I'm sure you're meaning like the impact of soul wellness, or like
Yes,
my
yes,
methods and practices. Oh, cool. Yeah.
yes.
All right. I think it's going to be a transformative experience if I say so myself. A lot of people that I experience and who come to see me to be their healthcare provider, they tell me the stories, and there's so many
Hmm.
stories of like how their provider has like made them distrust them in some capacity, or how they felt the provider treated them, or how they felt dismissed. And I'm like, I've been there before. And so I try to do everything I can to make sure that that experience is not repeated. So I really think it's going to be an empowering experience, for more, when I have more people enrolling in my practice, because that's what we do in 2025. Bringing more people.
No, that's right.
I know,
I
right?
know
You got to
that's right.
claim it. You know what I'm saying? So, as more people come into my practice, I am expecting that they have a transformative experience. I really say that the practice is designed for people to come in if they have a goal. So, if they have a goal of you know losing 20 pounds, or if they have a goal of optimizing their weight, way maybe they want to gain some weight for whatever sport that they may have be a part of. Maybe it's wrestling. Whatever their goals are. Maybe they just want to get their mind right, and help with their thoughts and get some encouragement. To me, I don't believe that it always has to be, here, I'll prescribe you something. Sometimes the prescription is you need a week off without going to your job. you know, you need time to
Mm.
rest. You know, I've even hand out. I mean, I hate to do this, but I hand out some prescriptions that say quit your job. you know, like you telling me how stressed out you are. You telling me you hate your job. You telling me, and then you coming in here sick because your job is making you sick. What we got to do to get you to a space where you can navigate this. And sometimes that is the prescription. That's the plan. And when you actually work where people are at in life, and not just treating symptoms, you know, I believe people get a better wholehearted experience when trying to heal themselves. And having a provider that can empower you makes you actually want to engage in your healthcare more each day. So I believe it's going to be transformative. Can they add that into the medical system right now so everybody can just be healed? That would be a miracle.
Well, it would be.
That would be a miracle.
But see, I think the purpose of that prior question was to know that, if your patients believe it, and they see you actually out here on this broadcast where you're speaking of not only the techniques, but what your goals are and so forth. that it would be an enlightening experience for them, because it's like you really believe in what you're doing, and you are results driven, and you're getting the result.
Yeah.
And so that's what I'm thinking, that when it comes to healthcare, we all know, especially with this young lady that's a doctor that just popped up on the CBS Morning News last week or 2 weeks ago, was talking about the divisiveness in healthcare, especially when it comes to if you're black compared to white patients, and how she was almost killed because of something that the doctor did. You know,
Absolutely.
and so I think primarily, when you have medical professionals that come to shows like that, those are impacts. And it's like it drives the people to say, well, I want to go see what Dr. Ford has got going on.
Yeah, absolutely.
Because that sounds like something that I need. I would love that. And I'm sick of this corporatism, and it's tearing me down. It's making me feel all these different ways. So maybe I need to go and find out what are these methods and techniques that he's got going on that I really should have.
Absolutely. Because I'll tell you what, Charles, when people come into the clinic and they're looking for answers, really people are getting ping pong down to different specialists. And then when you go to specialists, especially, let's say that you have low back pain, which is a very common problem that we see in primary care. You have low back pain, chronic back pain. Sometimes providers will say, oh, you can't do nothing about it. Oh, you're too old. Your age. This is just what happened. When you hear those type of things, it's like people get discouraged. They get beat up. And then what makes the situation even worse, which goes back to this individual who reported about her situation on news, is, instead of working with the patient, trying to figure out the root cause, they'll actually be ready to operate on you versus even giving you other alternatives. It's like, put you under the knife. We just give you all of the new types of drugs that we can because we want to try it out and see if this works for you. And the worst thing that I find is when people have a diagnosis that doesn't really explain what's happening to them. It's just a diagnosis that encompasses a whole lot of symptoms. One of the diagnoses that you probably heard of is like fibromyalgia. It's like people with fibromyalgia, people with irritable bowel syndrome, these conditions, and they're told by providers that you just have to deal with it. I'll tell you, people are shocked when I talk to my patients and I'm like, have you ever envisioned a life without your blood pressure medicine? And they're like, I've been taking my blood pressure pill all my life. A provider just told me to go ahead and take my blood pressure medicine and whatever. And they just, every time I come to the office, they say my blood pressure's normal. And then I'm like, okay, did they ever say to come off of the blood pressure medicine? Like, did you ever like revisit that conversation? And like, you want to stay on there for the rest of your life? And they're like, oh my God, like, I never thought of that. And I'm like, that is why I do the work that I do. You know what I'm saying? To like get down to help people see it for themselves, because they will just literally be like, oh, my blood pressure is high. I was told that. I have a diagnosis, so let me just take my medicine, and we'll be taking it for years when they could have just did, a detox or something, and, maybe worked some things out. Maybe they were angry. Maybe they had a lot of stress going on in their lives at that time. Like, what are some more natural ways that we can help heal the body? Instead of just saying, take this pill, go to the gym. Like, people, that ain't resonating with everybody. So I really do believe that, the approaches and the techniques are transformative, but because I really help dig deep and empower patients to really take full ownership of their health.
Wow, because now let me tell you this. Just as you mentioned blood pressure, and it's always one of those things they say, well, it's chronic and it's critical in the Black community.
Mm-hmm.
How about a lot of healthcare providers? It seems like they're not up on what these actual medications are doing to the individuals, because it's been this was in 2023, and there were two different stories to come out, at different times, but they were both saying the same thing about some of these blood pressure pills are actually causing valve leakages, or causing heart attacks, causing strokes, just causing all kind of issues with the heart, and it's the pill that you're taking. So it seems like, when people are afraid, I know especially in our communities, we're afraid of doctors, is because they're probably going to give you something. They don't look like you. They're going to give you something that they know is going to kill you. And so when you're taking these medications, especially those, when you see this and you take this back to your healthcare provider, you say, hey, they say that this amlodipine is causing heart attacks and strokes and all kind of heart conditions. Why are you giving me this? And they look at you and say, oh, no, that doesn't apply. That's in Europe.
That's what they will. That is so sad. It's so sad. It irritates me because at every medication commercial is gonna have that long spiel at the end of it and say that can lead to XYZ cancer, this, that, and then you hear some things you're like, oh my god. But then at the end of the commercial, you're like, well, damn, I kind of lost hope in everything. I just got to go ahead and get that medicine. It's like, what? But
ain't that crazy?
But in people's defense, and these individuals who are looking for solutions, they're looking for solutions. That's what's driving them, and no one's giving them a clear answer. And especially when a patient comes to me like that, who says, oh, why are you giving me this medication? Me, I'm ready to snatch you off of it. But I will say this, medications are necessary in certain predicaments, but this is a substance, this is something you're putting in your body. It's manufactured. They may use different dyes, they may use different chemicals to help, preservatives to help the medication stay, fixed and potent, so it can be shelf and then end up being your body. So then, all of these different additives may not sit well with your body, and you take the medication repeatedly over and over and over every day. You think about how much you're just compounding, all that dye, all those, additives, and the medication is just compounding in your body. Me, I think that for people to really make a shift, I always think a detox is a good thing for a person to do. And I say this, and people are like, detox, why are you alcoholic? I ain't talking about all of that. I'm talking about detoxing, where you are stripping your body away of some of these toxins that you've been exposed to for years, especially if you've been around a family who were smokers. You may have been exposed to those toxins as a young child, and if you haven't really detoxified your body, you may be still holding on to a lot of those toxins. So I think that's important. I also say this: detoxing your body is like, think of your body as a car, and every so often you got to get another oil change. Like your liver helps detoxify your body, and it's a filter. And every so often you got to change that filter. You obviously can't change your liver. You need your liver to live. You can't change that bad boy, but you can do a detox to help cleanse your body. Whether that's fruits and vegetables, whatever.
So, see, those are good things. But what I guess the whole premise of that whole thing was, it's like, why am I going to take an eye drop that's going to cause me to have a stroke, and it's going to cause me to have pink eye, and it's going to cause me to have blotches on my skin? Why am I going to take something that's going to supposedly help me with irritable bowel syndrome, but it's going to cause me to have Crohn's disease where I got to cut intestines off?
Right.
These are the kind of things, because it's all synthesized. It's all synthetic drugs. But this is what they're giving folk, and they're especially feeding folk this in the Black community. Absolutely. That's why there's so many illnesses, and people are just dropping like flies.
Absolutely. I would agree that, unfortunately, a lot of people are on many meds. I mean, sometimes I see lists about 20 meds that I'm like, what? Like, what are you taking? Like, what? Like, let's start. What the hell is going on now? But the list, and I mean, kid you not, the list seems to get longer, and that's so unfortunate. But my question is always this: if you didn't, if you didn't get, if you're not going to take this medication, what are we going to do to help in this moment? Because some people are like, "Oh, I ain't taking no pills, I ain't taking no meds," but then I'm like, okay, so then what are you going to do to help in the interim? And some people are very motivated that they'll get active, to make sure that they're eating properly. But I guess my whole point is a lot of providers don't know how to get into that space to like help coach them to know what is good and what's healthy, or what is some alternative medicines that you can use for eye drops or solutions, because there are herbal medicines from plants that are natural that you can use to help with some of these ailments, So, but how many providers are actually getting into that without you having to go get referred to somebody and then wait a month or two to get in there? And then it's like, I'm scared I'm about to have a stroke. Help me out. Like, I'm like trying to get my health together, and I got to go to another specialist. I got to go to another specialist. It's like, what?
But it's the kickback that they get for getting folk on these drugs, though.
Yes.
There's a kickback.
Yes. And
but I mean, not too many people talk about that, but that's something else to just. I'm just wondering because see, when we think about the wonderful way that you're treating people, especially going with the treating the mind, body, and soul, and it's like it's non-traditional.
Yes.
There's a lot in that because sometimes a lot of us lose our way, and as you're saying, the detox is probably the best thing in the world. But because you say, "Oh, I'm just gonna detox," and the doctor said, "No, let me just slip some of this in there." So you slip one of these little pills in there that you take. The detox ain't gonna work.
Yeah. You have raised a good point. You're right. You raised a good point. The detox is the point. Like, I recommend doing a detox every 3-4 months. Just to give your body a reset. And it's just like I said, it's like changing out the oil filter when you get an oil change in your car. They're doing the whole thing. So it's like, why not, treat your body the same way and give you that reset? I think that is super important. But you raised a good point about providers wanting kickback or prescribing medications because they know they want something. But I think sometimes in the medical community, oftentimes in the medical community, there's a disservice to let people know like how these medications impact them. I'll give you an example. Ozempic and Wegovy, some of these weight loss injection medications have been really popular, especially within the past year. And so many people are coming to the office and they're asking them to be put on these medications, but they're not knowing how the medication works per se, and how it can slow down your gut, and how it actually you have to actually start making. You can't just be out here just doing whatever on the medication. And I can't pull it out of you. It's an injection. I can't just say stop taking that medication tomorrow. And then you just stop taking the pill, and then it's out of your system. No, these medications, they work, for a long time. They stay in your body for a long time. So I say all that to say, people are not getting good information about these medications to make a good decision about using them. And I know it's convenient, and providers are making that cash on it, but like at the end of the day, that's not what it's worth to me. I want to make sure people are safe. If you want to lose weight and we want to get on the medication, cool, but let's come up with a plan to get you off of it, because you ain't about to stay on it for the rest of your life. I'm willing to work with people too, meeting people where they are.
That last medication that you mentioned, for weight loss and so forth, You see, a lot of folk, you're right, they don't realize or know that that thing is also there's a class action lawsuit for that right now because it's causing stomach paralysis, and I've never heard of that before in my life. But I'm thinking stomach paralysis. Now
Yes.
you know if you're paralyzed, you can't move. So if your stomach is like that, what is your stomach doing? Well,
Not
you got
nothing.
stomach paralysis. You know, I don't know.
It
That's
ain't
crazy.
moving, no moving nothing through. And and people died, because it's like when you have paralysis in that area, obviously you're not moving, food around, poop around in your gut to get it out. And then also you are blocking the nerve endings and the blood vessels that go there. All types of complications can happen when you get backed up. And so now your gut just becomes really infected and the tissues die. So it's really serious. So I don't really be liking to play around with this, especially when people are like, "Oh, just give me that pill," because they want to lose weight now. You know,
Instant gratification.
yes, instant gratification, and I find that to be very, very dangerous. For people to do that. So I always like to coach my patients through it. Like, is this something that you're sure that you want to do? Let's explore some other options. Or if you really do want to do this, let's come up with a plan.
Yeah, I just I'm sorry that we had this like this little technical difficulty going through our hour, but I definitely want you to come back because we've got to make sure we fix that because we got to get people to understand a whole lot more about the methods that you
Oh,
use
absolutely.
uh, because I think that's really important.
Yeah, absolutely. It's not something that's being done widely in the medical community. And, focusing on a person holistically, mind, body, and spirit is essential for people to embrace a new life, and change their perception on their health. Because if you think that you're going to have poor health, you're going to end up having poor health. But if you believe that you can actually be healthy and you can overcome these illnesses, you give yourself a better chance of fighting through it and prevailing. So it's not something that happens often, but it's something that's definitely needed. So I'm more than glad to come back and talk about it for sure.
Oh, most definitely. So in closing, Dr. Ford, please tell our audience something that's really good that they should try if they're not trying already that would do the body good.
Oh, that's a great question. Do something good for the body. This is something that's going to come to y'all real hard, okay? But relax. Chill. Especially in major cities, people are running, running, running all the time and not focusing on themselves. You'll do for other people before you do for yourself. Relax and take some time to heal, okay? Especially when you're falling with illnesses, it's going to be super important that you take time to rest your body. I had a patient today who said, "I'm at work." I said, "I thought you were sick." He's like, "Well, I got to go to work." I understand and I hear the concern, but you may not be able to show up for work if you don't take care of yourself. So just keeping that in mind. Just make sure that you take the appropriate time that you need, rest and relax your mind, relax your body and your spirit. And you can do this by deep breathing, taking a moment for yourself, stepping away from what you're doing, or just laying down in your bed and just resting. So relax is my biggest tip. I think that's really crucial, especially now we have a high level of anxiety all the time, especially with social media. It's like take a moment for yourself.
Well, I want to thank you for your time, Dr. Ford, and we're definitely going to have to, I'll have to send you out some communications because I definitely need to get you back where we don't have these technical difficulties because what you're talking about is very, very important.
Absolutely. Thank you so
And
much.
And I want for all of our audience out there, just take heed to the tips that Dr. Ford just gave you guys. But also make sure you please go to the YouTube channel where if you're watching it through there, please leave some comments. Please let us know if you think Dr. Ford is your pick or your choice for the American Black and White Person of the Year at the end of the year. We need all of that feedback as well. But we'll have Dr. Ford back again, and we will definitely revisit this medical situation because people need to know these things.
Absolutely.
So until you guys have a great evening, and we will see you next week on America in Black and White.